thank you everybody for being here on this webinar series. So tonight we have the wonderful Sue Camp, who is with us, our hormone expert. She's doing an amazing job at helping people once they have their results, so offering consultation within the Omnos platform. But you also, do you want to give a bit of a intro about yourself? I mean, you've done a lot, so let's try to keep it short, but...
Thanks, Thomas, and thanks everybody for joining us tonight. It's a real pleasure to be with you. My name's Sue Camp. I'm a nutritional therapist and a certified functional medicine practitioner. I'm based in the UK. I work online at a couple of clinics in central London. And the area of expertise, or the area that I really enjoy, is hormone health, digestive health, thyroid, adrenals, some weight loss. Of course, it's all connected. And the thing about functional medicine is that we're trying to join the dots. And that's what we're going to do with Omnos and your results, is join the dots between not only your results, but your symptoms and everything else that's going on for you. So it's going to be a ride. It's great to have you with us.
And just a quick, I'm not going to bother everyone with what we do exactly at Omnos. But you're probably, most of you, familiar with it all. But this webinar series first is about educating our audience to make better informed choices. And the reason why we do that is because you can make a lot of different choices, and sometimes could be the wrong one by following trends and things that not necessarily are relevant for you. And the problem we're trying to fix is very simple, is this ever-growing pandemic of chronic illness that we're all aware of, okay? And it costs a lot of money to the NHS. And unfortunately, 30% of the people who are suffering of this condition are actually representing 70% of the budget for the NHS. So we now have amazing tools and amazing ways of potentially prevent those things to happen. And I really am a believer that the more information we have, the more informed choices we make, and the more prevention there is. So what we're trying to do is, because being informed is a good thing, but it's hard to be informed right now because the information we have access to are very complex. So if you were to do any medical test, well, if you don't have a medical degree, it's quite difficult to understand. So this is why we created the Omnos platform, is to really try to democratize health in the sense that we're really working hard on making the complex simple and try to deliver personalized information while doing that. So things that are relevant only to you. In that sense, the way the Omnos platform is evolving, my platform will be very different from your platform, will be very different from Sue's platform in terms of the recommendation we give and the education you will receive. Simply because there's a lot, but what is relevant to you? What are the changes that count for yourself, really? So by doing this, we're trying to decentralize health. It's something I keep repeating because I truly believe that, you know, there's places where we break down, but if we talk about health optimization, it cannot happen in a hospital. It cannot happen within clinics, or we can create a new environment where actually there's all those different touch points, or even from, you know, your phone, getting you being at the center of it, and the health education and optimization comes from there. And data ownership, we're also very strong about that, in the sense that we want you to be at the center of your health, and you need to have access to all of your data and be in the know, really. Right now, the platform is quite easy. You start with a self-assessment. Once you have done that, it tells you about who you are, what you're doing. And it also gives us an idea about a few symptoms you may have. So then it's quite easy from there to already guide you to what is the best next step for you. And once you have done that, let's say you do a test, and let's say it's a hormone test, and let's say you find out that you're estrogen dominant. we sort of connect the dots with it all and tell you, okay, well, this is the top things you should be knowing about that. And this is what you should be doing. This is what you should be avoiding. Maybe some supplement to take here for very specific, I don't know, toxins that you want to eliminate. And we give you all this into targeted optimization sort of recommendation. So those are all the original tests that we have. We started with all this. Genetic, because I like to invite everybody to create their just own relationship with their own biology. Toxin is an amazing test in terms of understanding your metabolic health and also all the toxins that may impact your health, even looking at certain fungus and all those different things. And microbiome obviously is about looking your what we call dysbiosis, so the imbalances, but way beyond that, it's also looking whether you have certain type of parasites and how much of it, which ones, and how does this impact certain pathways. Do you have leaky guts? So no wonder why you're feeling so bad and you cannot sleep and you have hormones problem as well. So actually that is your priority to fix. Then elements, looking at all different minerals and vitamins and also their ratio, which is very important. So a ratio will tell you, for example, I don't know, one of my issues that I discovered with this test, having forgotten that I had mercury filling, since, they were actually interfering with mercury. Obviously it's a heavy metal and it's not very nice. And they were interfering with my zinc, with my selenium, which were all low. And all this was, making more prone to infections and having a lower immune system. All this because of just mercury filling, that I was being poisoned all the time with. Hormones, we know about our hormones. We're going to talk a lot about it, so I'm not going to say much about this one now. But why are we adding all the blood tests to the mix? It's simply because it just makes sense. First, in the whole spectrum of things, we understand about who you are through self-assessment. We understand what you are made of with a genetic test. What are your predisposition? Now we want to know what is actually circulating in your blood, what is actually happening within your body right now, in comparison to all the rest that we already know about you. So then we can really give you the most granular path forward for you to optimize your health. And that's very important. So we already look at all those different functional tests, so through stools, urine, and depending on the symptoms you may have, we might recommend one or two of those. You don't have to do all the different tests. It depends on what are the symptoms you have. But it's always then trying to go more and more granular, especially for you not to do all those tests because it can come expensive. So we're always trying to make things a bit more granular so it's less expensive, but you also track the things that count. And yeah, so there would not be really, without adding the blood test, a full assessment of understanding how your organs and different system works, and how we can actually help you doing that. So it's very important to add them to the mix. So this is what we've done. And we come up with those 7 amazing blood tests, different markers. So if you look at the wellness one, you have the wellness normal, which is 18 markers. The advanced is 24 markers. And then the wellness complete is actually the combination of the 2 plus more, because you sort of understand more things, but they are very complete tests. So I'm going by that. And now we also have the thyroid, which is also a very important test. It's a sort of standalone test, but it can still be related to a lot of different things. So even from an element test, for example, we can understand from certain ratio, well, maybe you do have imbalances here, and actually from this ratio between 2 minerals, we understand that you might have thyroid issues. So let's investigate this, especially if you have, on top of that, from your gene test, some imbalances or some thyroid predisposition issue, especially if it's already running in the family. So, it's all of this on multiplier. So yeah, let's talk about all those different tests here, and specifically the hormone test. So we've done last week, yeah, it was last week. Sorry, I'm losing track of time a bit lately, being a bit busy. But we've done last week with Christian, the same webinar for all the wellness tests. So it's now available on the YouTube channel. So you can also look at this one later if you want. But right now, enough talking from me. It's your turn, Sue.
Thanks, Thomas. Thanks, everybody. It's a very exciting time at Omnos, and I'm very excited about adding these new blood profiles because I think it really rounds out the functional testing that Omnos is providing and the answers that it's going to be able to give you for your health. So why is it important that we evaluate sex hormones? Why is that such an important part of our health? And basically, obviously, we're all different. We're not only different in terms of males and females, and females, obviously, we're different in terms of stages of life, whether we're going through a fertility phase or a premenopausal phase or a postmenopausal phase, and they're all going to give us different information. Hormones drive so many different aspects of our health, whether it's mood, whether it's energy, whether it's metabolism, whether it's fertility, whether it's libido. Hormones play a hugely important role in our everyday health. And some days we love them and some days we fight them. And I think understanding our hormones just gives us so much more information about how we can work with them and what we can do about it. Yeah, move on. And so see, these are some of the symptoms that you may be experiencing. And if you are, then these are the tests that may give you some more information. So for women, we talk a lot about premenstrual symptoms and the whole array of premenstrual syndrome and the many symptoms that accompany that time of the month. Menstrual cycle irregularities, long periods, short periods, spotting in between, any issues with infertility, stages of female lifelines in terms of perimenopause and menopause, PCOS, polycystic ovarian syndrome, hair loss, acne, mood swings, fatigue or low energy, low mood, depression and weight gain. And then also for men, so when we're thinking about hormone profiles, we generally tend to think about women, but not to forget that men also have hormones. They have both female and male hormones, and they have their own issues of hormone imbalances, including erectile dysfunction, hair loss, acne, mood swings, fatigue and energy issues, depression, weight gain, and infertility themselves. So when we're looking then at what can we do about this? We're looking to unravel the root cause. So always in functional medicine and preventative medicine and this kind of democratization of health, we want to know the root cause of it. It's not about a pill for an ill or whether it's a green supplement or a drug, but what is the underlying imbalance in the body system? And which of these hormones or which collection of hormones may be out of balance, resulting in any of these kinds of symptoms. And that's the kind of thing that we want to work with you to try and help you understand better. So if we move on, we I've just listed here what is included in these particular profiles. So I do a lot of testing in my clinic, and I think this is a very comprehensive collection of some of the most important markers that are going to give you some information to give you an idea about the underlying imbalances and those symptoms that we've just discussed. So we're including progesterone, estradiol, prolactin, and you can go through these and the slides are there. Testosterone free and total, so bound and unbound. Sex hormone binding globulin is the protein that carries our hormones. Luteinizing hormone and follicle stimulating hormones. So these help to drive our menstrual cycle and ovulation. Cortisol, obviously our stress hormone, and then our blood proteins. So albumin and total protein, globulin. And then, of course, all the thyroid. So a thyroid panel can be bought separately, but it's included in this particular profile as well. Our thyroid hormones and our sex hormones work very closely together. So having them on this panel is really helpful. Having more than TSH and just T4, which is all you're going to get from your doctors, is also really helpful. So we've included free T3, that's the active thyroid hormone, and we've also included the antibodies, so TPO, thyroid peroxidase antibodies, TGA, thyroglobulin antibodies, so that you know if there's any kind of autoimmune aspect to any thyroid imbalance. And then we've got the cholesterol markers, and crucially vitamin D. It's not measured enough by the medical fraternity. For many, many of us in the UK, it's low. And if you can measure it now at the beginning of winter, it will really help to inform the dosage that you need to be taking during winter. It's a great profile. But we didn't neglect the men. So the male sex hormone complete includes all of those markers as well as PSA, so prostate specific antigen, just to be able to track and take care of prostate health. So all of those are important too. And obviously there are male and female reference ranges, which we're taking care of. And then to add to that, we've also included a fertility profile. And on the fertility profile, we've included everything that we've listed there, and we'll go through some of the important markers, but also anti-Müllerian hormone. So that's the kind of ovarian reserve that women who are perhaps slightly older may be concerned about egg reserve in terms of fertility, and that'll give some more information around that. So when we're thinking about fertility, these are some of the markers that we've included and why. Excuse me. So estradiol is obviously our main female sex hormone. It's what peaks during the first half of our cycle and takes us up into ovulation and plays a really important role in building up the lining of our uterus for that fertilized egg to implant. Luteinizing hormone helps to mature and release the eggs for ovulation, helps with that production of estradiol and progesterone, and these are key fertility hormones. Follicle stimulating hormone is what stimulates our ovaries to produce estradiol in that first half of the cycle. Thyroid hormones, when we're thinking infertility, we don't always think about our thyroid, and yet they play a hugely important role in fertility, and thyroid antibodies and any autoimmune function can be an important factor in infertility. So checking those are really important. Vitamin D is hugely crucial. Higher levels are linked to improved fertility, so we want to make sure that you're at optimal levels. And there's the anti-Müllerian hormone that we were talking about. So levels help show how many potential egg cells a woman has left, and that's the ovarian reserve that we're talking about. So again, if you have been struggling, or maybe you're just starting your journey of fertility, it's incredibly empowering to have this information and know where you're at the start, and if there are any imbalances, to address them. So now we've got a situation where we are we're offering you the option to measure hormones in urine and in saliva in our Dutch profile. And now we're offering the opportunity to measure your hormones in blood. So does that get a little confusing? When do I use which sample? And there was a wonderful analogy that I learned when I was working in the functional lab tests about using an analogy of money. So when we're measuring hormones in blood, remembering that hormones are fat soluble and they can only transport or be transported through blood through transport proteins. Think of them as little taxis, if you like. So there are a range of transport proteins that are used in the body to transport hormones. And you might have heard of sex hormone binding globulin, which transports our sex hormones, thyroid binding globulin, which transports our thyroid hormones. So when we're measuring them in blood, we're measuring both bound and unbound fractions of those hormones. And if we think about money, it's a little bit about having a stash of money tucked away in any kind of investments or ISAs, perhaps. You have it there as a reserve, but you can't necessarily access it. And those hormones that are being carried in those binding proteins may not be freely available to the cells, but they are being bound and they are there as a reserve. However, if you draw your investments down or you draw from that ISA, you then have cash, and then you have cash to spend. And that's what we could equate to saliva. So when we're looking at measuring hormones in saliva, and cortisol is very often measured in saliva and partly measured in saliva in the Dutch profile, we're looking at the unbound and now bioavailable or freely available portion of that hormone or fraction of that hormone. It's a much smaller amount. It may only be 1 to 3 or 5% of that hormone, but it is a bioavailable fraction of that hormone. And so it's answering different information. And then if you just go back, and then we look at urine. So when we're looking at hormones in urine, once you've spent that cash, and then all you've got left for that spending, if you like, is your cash slip, your receipt. That's what we're looking at. That's what we're looking at when we're looking at hormones in urine. It's what the body spent, or we call metabolized, and what are the end products. So what has the body got to show for it, or the end products for that process of metabolism. So it kind of gives you an analogy of the different ways we're looking at measuring hormones and the different answers that it's giving us. So let's go into a little bit more detail. So if we're looking at blood, measuring hormones in blood, it provides that measure of circulating hormones, both bound, our reserve, and bound, our active, as I was talking about. Finger prick or blood draw. This is the most studied sample type for hormone assessment. It's useful for a kind of baseline of hormones. So in terms of looking for baseline, ideally before any kind of HRT or any changes to your hormone levels, this is a really useful way to check. Bloods are what's mostly used by your GP or medical team. So if you're working with your GP or medical team, they will understand these markers much more easily. Obviously, pricking finger for blood doesn't allow for any kind of patterns during the day, circadian or diurnal patterns, and it doesn't allow us to look at those pathways of estrogen metabolism. So then if we look then in saliva, so when we're measuring hormones in saliva, we're collecting it in a tube, and it's looking at that unbound free active hormone. So that's the cash that we've drawn out of the investment. It's an easy at-home collection. We can collect for multiple samples through the day. We can track our circadian rhythm of cortisol and any other hormones, and it's measuring that free circulating bioavailable portion of the hormone. But it doesn't give us the metabolized cortisol, which is our overall production. And so when we're then looking at measuring hormones in urine, we've in many ways got the best of both worlds in a sense. So it's an easy at-home collection. We can look at the circadian patterns. It gives us an indication of both free cortisol, active hormone, and cortisone, inactive hormone. It does give us metabolized cortisol, which is an indication of our overall production of cortisol, for example. We can look at the androgen pathways, so DHEA and testosterone, and how we metabolize those down to DHT or not. Evaluates our estrogen metabolism to 2-hydroxy, 4-hydroxy, 16-hydroxy. Which of those pathways are we favoring? We can include melatonin, and we also look at 8-OHDG, which is a marker of oxidative stress or cellular damage, and organic acids. So those are the different kinds of information that we can get when we're looking at these different types of samples to measure our hormone levels. So I guess the question then that's on your lips, so when would I choose to use a hormone? And this is if you're working with your GP and your medical team, they're going to understand bloods. If you want to track blood markers over time, that's much easier. There are particular markers that are in those panels that we can only measure in blood. So our thyroid markers we can only measure in blood, FSH and LH. And the blood proteins we can only measure in blood, and obviously blood cholesterol. So there are particular markers that we can only measure in blood, and we don't have any other options. So testing hormones in urine, when we're looking at the pathways, we're looking at the bigger picture. We're looking at that kind of steroidogenic map that the Dutch profile gives us. We can do that in urine, and we're looking at how our body's metabolizing those estrogens and those end products or metabolites that can be helpful. When we're looking at our cortisol, is it way high and we're kind of wired but tired, or is it way low and we're burnt out? That we can look at in urine. It allows us both cortisol and cortisone, and then those organic acids or metabolites in terms of a need for particular nutrients around B vitamins, glutathione, etc. So different information. And there is our infamous cycle. So there are the the process, or our monthly cycle, looking at the estradiol, the progesterone, the luteinizing hormone, and the follicle stimulating hormone, and those different phases that we're going to go through every month. So then I think I'm going to hand back over to Thomas.
Yeah, so it's few question might be, so how do I do to take this test, right? It's quite simple because you receive it at home. You have just this pretty box here. I actually have one here. So you have this box here that arrives. Simply you can slip like this here, and everything is inside. So obviously we have the instructions, and then you will find this simple blood prick test. And this is the big difference. It's not a big invasive test in the sense that it's not phlebotomy. So it's just a little prick that you apply. You try to keep your hand warm. So we give you a few tips here. In terms of preparation, the best thing to do, usually in general, as a general rule for blood tests, is to try to do it fasted. So nothing really intervene, but also hydrated. That's quite important. So in the morning, ideally, right? And then in terms of preparation, we just have a little form where you put all your details, and then you can have all the different things. So you have a sanitation swab, you use the lancet. After that, once you have put your hand in hot water, for example, for the ones who always struggle to have warm hands, having warmer hands or warmed up will help the blood flow, obviously. If you still struggle, you can still go like this and sort of massage down, leaving your palm down. And then it's just this little blood prick, and then you have to feel one of these here. So it's not huge, just not to scare people off. And it's not huge, it's quite easy, but then you send it back. And the big difference as well is in the time it takes to get your result, because blood is a bit faster in terms of analyzing it. So you get your result between 3 to 5 days, which is a lot quicker than other type of tests. So a genetic test, for example, will take a good 3 to 4 weeks to get results. So yeah, this is as simple as that, really. And then you get all your, just like we do it now, you get all your results on the platform. You can go through all the different categories of vitamin D's, for example. What are your level? What are the optimal level? The recommendation, we explain everything to you. What are your results and what it means to you, especially if you have other type of results, what it means to you in that context. And then what are the things you need to do about it? And if you want to know more, if something is more or less clinical, you have a wonderful practitioner like Sue would be really helping you towards optimizing and you know, changing things around. The things that are also coming on the platform, which I'm very excited about, and we needed obviously to go through to actually launch the blood test for that, is our mission in connecting the dots between all of those data to make even more of informed decision to you and things that make sense, rather than trying to have result in isolation, because sometimes it can be a bit misleading. So it's important to understand about your lifestyle, your symptoms, about your what's going on at a functional level for you, what is your genetic, but also what's circulating in your blood. And once you have this whole sort of overall helicopter view of everything, it's very important for us to help you prioritizing what needs to be done in terms of recommendation. And that really is going to help you, help everybody really into making the right decision, being more informed about what they need to do, and have a bit more of a clear roadmap on what needs to be done, really. And I've seen this many times with patients, or I'm sure Sue, you too. You may have certain symptoms that you think is not related at all, but once you start dealing with the most important thing at the top, so what is the source of your issues, then things start to go back to normal and at the granular level. So it's very interesting to see, and again, proving that what we do is integrative. We are connected, right? Everything is connected and nothing works in isolation to our amazing bodies. So the way it will work in the Omnos 2.0 is you have some sort of data point from your blood markers, and then our algorithm, which is basically all the brain of those wonderful practitioners put together. Algorithm, artificial intelligence is still people doing those things behind, so giving commands of what needs to be done. And it's the people behind that say, okay, well, in that scenario, but this is what it means, this is what needs to be done. And we really manage now to give you an idea of where are the area of focus for you to act on, really. And this is what we're doing. So no more about this because it's still a secret, but it's going to be amazing. And it's already something we're building now, and we'll be probably launching in end of January. But for now, you still can get amazing insights from all those tests, and especially all the new blood marker tests now. So I think there will be...
Thomas's favorite test is the genetic profile. And I think what the bloods do is that they give us an indication of our current physiology. And just a quick example, I had a call last week talking through some results with one of our users who had done her genetic profile, and she had some variations or SNPs or alleles, we call them, on her vitamin D receptors, her VDR receptors, which were compromised, and her vitamin D levels in her bloods were low, despite the fact that she had been supplementing at mediocre levels. So it gave us an opportunity to help her understand that her particular genetics meant that she needed to take a higher dose of vitamin D than the next person. And so it becomes really, really powerful when we put these two aspects of our health together and join the dots, as Thomas was saying, and then you're in control and you can make some very effective...
I mean, it's vitamin C, and entering winter, I need a very high dose of vitamin C. I have certain gene variants, and if I do blood tests, I'm quite low. It's really hard for me to get to optimal, except if I take at least 1,000 milligrams a day, for example. If I go and do, I don't know. So I need to just be really aware of all those different things, and it empowers you. And this is the idea: it's empowering you to make the right choice, but to also make the one that counts, really. So we have a few questions here in the chat and as well in things. So can we hear more about when to take the blood test during the cycle, actually? It's a good question. When would you take the test while you have cycle?
I just wanted to confirm this with you, Thomas, that we've got different reference ranges for different aspects of the cycle. So we'll have follicular reference ranges and luteal reference ranges. Yep. So what is important is that you note when in your cycle that you're taking it. And that's the most important. Is that correct, Thomas? We've got different reference ranges.
Yeah.
So you can take it either on ovulation or around the ovulation, or you can take it in the follicular phase or in the luteal phase. But so we would generally say either day 14 or day 19 to 21, but make a note so that we can apply the correct reference ranges to when you're taking it. For the fertility profile, it's usually around about day 3 of your cycle. So bearing in mind that day 1 is the start of your period or the start of your bleed, the fertility cycle is usually around about day 3. So I hope that answers your question.
And also on the platform directly, you have quite a lot of questions we've answered already. So yeah, it's something to look at. We have an FAQ, so with all those type of questions. So it's also something to look on the platform. Can we buy a test and for someone who's recovering from surgery, for example, yes, obviously, we can totally do it a few weeks later after buying the test. So that's a bit of a different question. It's something that can be done. Yes, definitely. Yeah. Other question. So there was HRT. So how would it help with someone who is, would it be helpful actually for someone who's already on HRT and someone who is about to get on HRT? How would this be helpful to do a blood test?
Yeah, really good question. This comes up a lot. So if you can do a blood test before you go on HRT, it will give us an indication of your baseline levels. If you can do the Dutch profile, the urine profile, before you go on HRT, it will give us an indication about how you are using or metabolizing those hormones. So that if we then add in hormones, whether it's progesterone or estradiol, it'll give us an indication about the way that your body's going to use it and which of those liver pathways and liver clearance you're going to use. So if you can, before you make any changes in your hormones, measure them so you know where you're at. If you're on HRT, then you can use it to track it. And again, I had a client this week and we're working with a clinic. I'm a nutritional therapist. I can't prescribe hormones, but we're working with a clinic and her estradiol was very, very high. That was checked in her bloods. And so they will check her dose and bring that down. So you can measure it to track your hormones over time and check your levels of particular HRT dosing.
Yeah, and even if you menopausal or postmenopausal, that's another question. Would it be useful to do a test?
Yeah, it's a really good question. So perimenopausal is a difficult time because we know that our hormones are all over the place. But yes, any information is helpful. So it'll still give you useful information about where you're at. And remember that sex hormone profile is not only measuring your hormones, but also looking at your thyroid and your vitamin D, and your cholesterol and your blood proteins as well. So it's not only going to give you the picture around your hormones, it's going to give you a much bigger picture of the functioning of your greater hormone picture, if you like. And absolutely menopausal. So after the definition of menopause is a year without periods, and thereafter, yes, absolutely, we're going to expect the estrogen to drop. Where is that? Where are your levels? And then it'll inform whether you want to do the HRT. It is generally recommended that HRT is probably more useful in the first 5 to 10 years after menopause. So again, it gives you more information about, is that the decision that you want to do?
Good. Any more questions? Just asking. It's always good to ask if there is any more question when you're live digitally. You cannot see the hand raised, but anyway. So if there's no more question, I just would like to share the code we have for this special launch on all the different blood tests that we have, which is blood 30, so giving you 30% off of any of the blood tests. And yeah, I would like to thank you, everybody. Thanks everybody for coming. Thank you, Sue, for your knowledge again and sharing it, sharing the knowledge and informing us all about hormones. And yes, thank you again. And I hope to see you very soon. All this will be uploaded on the YouTube channel. So have a look on YouTube, Omnos. We have different webinar already that we uploaded, and there will be more to come, some exciting ones very soon. So thank you very much for your time, and bye.
Thanks, Thomas. Thanks, everybody, and we look forward to working with you on these panels.
Thank you. Bye bye.
Have a great evening. Bye bye.